Hello, tuberculosis is the new millennium. Dr. Khalid Abu Rumman, USA. Introduction. One of the most contagious infectious disease, tuberculosis knows to no boundaries. Its reach extends to all economies, continents, and age groups. Tuberculosis (TB) remains a major public health problem throughout the world, especially in developing countries. The tubercle bacillus infects one-third of the world's 6 billion population, and tuberculosis is the primary cause of death from a single pathogen in adults. More than 8 million people develop active tuberculosis (TB) every year, and about 2 million die. In the last decade, TB causes the ground 20% worldwide. If this trend continues, TB will increase by 41% in the next 20 years. More than 90% of global TB cases and deaths occur in the developing world, whereas 75% of cases are in the most economically productive age group, 15 to 54 years, since it principally attacks young people during their most productive years. TB can look entire communities in a cycle of disease and poverty. When a patient ceases work because of lengthy treatment, or families absorb medical costs and may lose 3 to 4 months of income, and if the patient dies, there is an estimated loss of 15 years of lost income. In addition to the devastating economic costs, TB imposes indirect negative consequences. Children leave school because of their parents' tuberculosis, and women are abandoned by their families as a result of their disease. Poor living conditions, overcrowding, and malnutrition favor and spread of the disease. The prevalence of tuberculosis is increasing worldwide, concentrated in Southeast Asia and Sub-Saharan Africa, mainly due to deterioration in socio-economic conditions in these countries, ineffective treatment programs, and the spread of the human immunodeficiency virus HIV. The emergence of multi-drug resistant tuberculosis, mainly due to inadequate or incomplete treatment, also poses a serious threat for the future. Reason for the global TB burden. The main reasons for the increasing burden of TB globally are in an increasingly connected world of jetliners, mass transportation, and displaced populations. TB anywhere is TB everywhere. Poverty and the widening gap between rich and poor in various populations. Neglect of the disease, inadequate case detection, diagnosis, and cure, collapse of the health infrastructure in countries experiencing severe economic crisis or civil unrest. The impact of the HIV pandemic. Few basic definitions. Pulmonary tuberculosis, sputum smear positive, PTB positive. 2 or more initial sputum smear examinations positive for AFB, or 1 sputum smear examination positive for AFB plus radiographic abnormalities consistent with active PTB as determined by a clinician, or 1 sputum smear positive for AFB plus sputum culture positive for tuberculosis. pulmonary tuberculosis without AFB confirmation. Cases of PTB that do not meet the above definition for seropositive TB. This group includes cases without smear results, which should be exceptional in adults but are relatively more frequent in children. Severity of TB disease, bacillary load, extent of disease, and anatomical site are considerations in determining TB disease severity and therefore the appropriate treatment. Involvement of an anatomical site results in classification as severe disease if there is a significant acute threat to life, pericardial TB, a risk of subsequent severe handicap, for instance spinal TB, or both, for example meningeal TB. Miliary disseminated TB is considered to be severe. The following forms of extra pulmonary TB, EBTB, are classified as severe: meningeal, pericardial, peritoneal, bilateral or extensive pleural effusion, spinal, intestinal, and genitourinary. Lymph node pleural effusion, unilateral bone excluding spine, peripheral joints, and skin tuberculosis are classified as less severe. History of previous treatment, category of patients for registration on diagnosis. In order to identify those patients at increased risk of acquired drug resistance and to prescribe appropriate treatment, a case should be defined according to whether or not the patient has previously received TB treatment. This distinction is also essential for epidemiological monitoring of the TB epidemic at regional and country level. The following definitions are used. New: a patient who has never had treatment for TB or who has taken anti-tuberculosis drugs for less than 1 month. Relapse: a patient's previously treated for TB who has been declared cured or completed treatment and is diagnosed with bacteriologically positive smear or culture tuberculosis. Treatment after failure: a patient who is started on a retreatment regimen after having failed previous treatment. A patient who while on treatment remained or become again smear positive 5 months or later after treatment. Also a patient who has initially smear negative before starting treatment and becomes smear positive after the 2nd month of treatment. Treatment after default: a patient who returns to treatment positive bacteriologically following interruption of treatment for 2 months or more. Transfer in: a patient who has been transferred from another TB register to continue treatment. Other: all cases that do not fit the above definitions. This group includes chronic cases, patients who are sputum positive at the end of a retreatment region, treatment of TB objectives of a treatment to cure the patient of TB, to prevent death from active TB or its late effects, to prevent relapse of TB, to decrease transmission of TB or others, to prevent the development of acquired drug resistance. It is vital to achieve these aims while preventing the selection of resistance bacilli in infectious patients. And the 3 basic principles of treatment to follow are: 1. The regimen prescribed must have multiple drugs to which the organism is susceptible to. Drugs must be taken regularly. 3. Drugs must be taken for a sufficient period for time. essential anti-tuberculosis drugs. There are three properties of anti-tuberculosis drugs: bactericidal activity,